In this section, we are going to talk about teeth surfaces, as you can see on the board. Learning and knowing your teeth surfaces will help you classify your different dental decays, will help you learn the names of your teeth cusps and the different roots your teeth have, and these are the things which you will learn in the further sections. Now, the first two surfaces I want to talk about are the surfaces in between your teeth, meaning when we look at it from this point of view, this and this, this and this, and when we look at it from this point of view, this surface and this surface. The surfaces that are basically in between your teeth. These are called the interproximals, right? Now the interproximals are divided into the mesial surface and the distal surface. Technically, remember this is our midline, right? The line in between our central incisors is what divides the left side of our oral cavity with the right side of our oral cavity with the left side of our oral cavity. Now, anything that's towards the midline would be the mesial surface, and anything away from the midline would be the distal surface. So if we look at it this way, or actually let's look at this central incisor here. This is the mesial surface, and this is the distal. Now for this central incisor, this would be the mesial surface, and this would be the distal, since this is the midline. Now if we're looking at these molars here, this would be the mesial surface, because it's towards the midline, and this here would be the distal surface. Again here, this would be the mesial surface, towards the midline, and this would be the distal, right? Mesial, distal, mesial, distal, mesial surface, distal surface, mesial surface, distal surface, right? So I'm going to write that down and then we'll move forward. So we have the mesial surface and the distal surface. Now, these are your interproximals or interproximal surfaces, right? And just to add those notes, interproximal means between teeth. And I'll add the note here. Mesial is towards midline, and distal is away from midline, right? Now the next surface or surfaces I want to talk about is the outer surface, right? The outer surface here on both your maxillary teeth and your mandibular teeth. Now this surface here, these are your facial surfaces, right? Facial. Think about it, towards the face, right? Now the facial surfaces are divided into two. The posterior teeth facial surfaces are called the buccal surface. These are the surfaces which basically face your cheeks, right? The inside of your cheeks. These are the buccal surfaces. And in the anterior teeth, your facial surfaces are called the labial surface. It is the surface you see when you smile with your teeth showing. So those would be the labial surface, and those would be the buccal surfaces. I'm going to write those down as well. So you have the facial surfaces, which are divided to the buccal surface and the labial surface. Now the buccal surface is, I'll write it as a note, is posterior teeth, and I'll write cheeks as a point because it's facing your cheeks, and labial is anterior teeth, and it is facing, or I'll just write smile, right? I'll add the note here and say outer surface. Next, we are going to move to the inner surface, right? For the inner surface, this is your lingual surface. Now, think about it. If you put your teeth into occlusion and bite down, the area that you can touch with your tongue while your mouth is closed, that is your lingual surface. Now, your lingual surface, if it helps Lingual comes from language, and language comes from tongue. Hence, this is called the lingual. Now, another way we call the lingual surfaces is we separate the maxillary from the mandibular. The mandibular lingual surface is still called the lingual since it's towards your tongue. But when it comes to the maxilla, we can also call it the palatal surface, right? The palatal because it's towards your palate. Now, if someone refers to the palatal surface as a lingual surface, they're not wrong. Just know that you have that option to call it lingual as well, but it's called the palatal surface. And for the mandible, it's only lingual. That's your only option. I'm going to write those as well. You have your palatal surface and your lingual surface, right? I'm going to add notes for the palatal. We can say, or actually let's do this. Put both of these as inner surface. For this, I'll put maxilla. For the lingual, I'll put mandible. Right? And the last two surfaces we are going to talk about are the surfaces that you chew and bite on, right? On the posterior teeth, the surface that you bite on is called the occlusal surface, right? Basically, hence, when you put your teeth together and bite down, it's called occluding your teeth. And that is your occlusal surface, which you basically bite on or chew on. And then the anterior ones, which don't have the occlusal surface and they have edges, these are called incisal edges. Since they have the incisal edges, which help you bite, this surface here is called the incisal surface, which has your incisal edge. Again, occlusal surface and incisal surface. I'm going to write those down as well. You have your occlusal surface and your incisal surface. Now the occlusal surface and the incisal, let's do this and say chew and bite as a note, and I'll also add posterior teeth, right? It's on your premolars and molars, and incisal surface on your anterior teeth, basically your incisors. Okay, now to further understand this or get a better grasp, what we're going to do, we're going to also name a few of the cusps and a few of the roots that we have, just so we get a better grasp of these surface names. So when we look at our premolars here, right, our premolars or our bicuspids have two cusps. And if you look, we have a cusp that's towards the buccal surface and a cusp that's towards the lingual surface. Hence, this is called the buccal cusp and this is called the lingual cusp, right? This is the buccal cusp, lingual cusp. Even on our maxillary, this is the buccal cusp and this is the lingual cusp. On the molars, however, we have more than two cusps. Hence, we divide them into the mesial and distal as well as the buccal and the lingual. So you can see this cusp here. This would be the mesio-buccal cusp. Mesio because it's towards the midline and that's mesial, and buccal because it's towards the cheek. This is the mesio-buccal cusp. This one here would be the distal-buccal cusp. This cusp here would be the mesio-lingual cusp. This cusp here would be the distal-lingual cusp. On this maxillary molar as well. This cusp here would be the mesio-buccal cusp. This one here would be the mesio-lingual cusp. Mesio towards the midline, lingual again, which is your lingual. If someone calls it the mesio-palatal, they wouldn't be wrong. Again, here, this would be the distal buccal cusp, and this would be the distal lingual cusp. So this is how we name cusps, and we're also going to name roots as well. As you can see, this is a mandibular a mandibular molar. Our mandibular molars have two roots, and the roots are placed mesially and distally. So this is how it would be placed. The root that's placed mesially is the mesial root of the mandibular molar, and the root that's placed distally is the distal root of the mandibular molar. Now, we're going to make it a little bit more complicated as well. This is a maxillary molar, right? Now, there's a cross-section here, which we don't have, but we are going to still look at these roots and as well as this one. So our maxillary molars have three roots, right? And they're placed like this or like this. We have one big palatal root because it's towards the palate, and we have two buccal roots, right? Which is towards our cheeks. Now, the two buccal roots are called the mesiobuccal root because it's towards the midline, or it's on the mesial side, and the distal buccal root because it's towards the distal. And since they're buccal, they have the buccal name as well. So mesiobuccal root, distal buccal root, and the palatal root, which is towards our palate. All right, I'm going to erase this, and we will go over one other thing in this section. Another very important way we cross-section crowns is we split them into three different parts. Basically, I'm going to draw a maxillary central incisor. Now, it's not the best, but you'll get the point across. Now, we're not going to talk about the root at all, and we're just going to focus on the crown, right? If we split this crown into three sections, right, we are left with basically 3/3. So we're looking at it, if we're looking at it this way, this is 1/3, this is another third, and this is the last one, right? These 3/3 have names as well, and this will help you, especially when you want to classify decay on your anterior teeth. This section here, that basically has your incisal edge and your incisal surface. This section here is called the incisal third. This middle section is called the middle third. And the part that's towards your gingiva, or your gums, right? Your gingiva is your gums. The section that's towards your gums is called the gingival third. Gingival. Now, another important thing is the gingival third has another name, and it's very important to know that name as well. It's also called the cervical third. Now, some exams and tests might refer to it as the gingival third. Some might refer to it as the cervical third. Let me write that clearly. Cervical third. And make sure you know both names. Now, if you're looking at it from here, this part here would be the incisal third, right? Since it has your incisal edge. This part here would be your middle third, and this would be your gingival third. Even if we're looking at it lingually, it would be the same. This would be the gingival third, this is the middle third, this is the incisal third. And same thing with the mandible. This would be the gingival, this would be the middle third, and this would be the incisal third. Now, we never refer to them as the top third or the bottom third because on the maxillary, the gingival third would be at the top and the incisal third would be at the bottom. But on the mandibular, the incisal third would actually be on the top and the gingival third would be at the bottom. So make sure you refer to them as this and not as the upper and the lower. Thank you. I hope this was helpful, and I hope you're able to retain all this information, which will help you in the further sections.